I got into the D&P program, started working my way through, and got asked to be a part of the ANEW grant, which does a lot with the rural communities and, learning to serve those communities from the nurse practitioner standpoint.
I got the ANEW grant my second year of the program. This was the perfect opportunity, I think, for being able to cut back on my work hours to part-time and still maintain good grades in this program.
The students do a longitudinal clinical experience in a rural or underserved setting, and that experience is at least 2 semesters or a year, so that the students can not only learn about individual patients or clients, but they can also learn the community and learn the assets of the community or barriers that a particular community has.
It would have been more of a struggle for me to get through the program if I had not had the ANEW grant. I would have probably had to go part-time in school because of the need to work full-time or part-time hours. It would have taken me not just 4 years to finish the program, but it might have taken me 5 or 6 years to finish this program, which puts fewer nurse practitioners out there.
One aspect of the grant is the financial support that we offer up to $22,000 a year for students who are participating in the grant so that they can decrease their work hours and be able to focus more on their education without that financial stress of having to pay for school 100%.
Being part of the ANEW grant, along with family support, really helped me to be able to cut back on my time that I was working and focus more on school. By the ANEW grant meeting some of those financial burdens that were there through, the schooling process as well.
Primarily it goes to pay for tuition and fees, and then there's a book stipend with a living expense that can cover travel or any additional fees that the student kind of comes across for school.
I would encourage people to utilize the ANEW grant from the very beginning. And I think it's a great benefit to the student, not only because you provide them with additional funds, but they're able to focus on the academic side of things more than, some students would be able to had they not been able to get that grant.
I completed my doctorate in nursing in 3.5 years, doing full-time, and that was, while working, I was able to do part-time work and everything with the help of the ANEW grant as well. But I was able to maintain my job, go to school, take care of my family, and still come out alive on the other side of the stage at graduation.
They are working with rural areas and trying to establish patient care with the family nurse practitioners. And the goal is that hopefully that those facilities that are being contracted through that grant will hire these students when they're done so that they can, help provide that care.
There's a spot in Benton County Pea Ridge. It's a growing area, but it's still considered a rural area. And I'm hoping to maybe get a position up there. I've done some of my clinical training there as well, and I've grown to know some of the people there are in Pea Ridge and their families. You see their kids, you see everyone, and you kind of have a sense of family and a sense of community there.
I really feel that the U of A and the support that I had with the staff and the ANEW grant really helped build a good building block for my foundational practice as a nurse practitioner in a rural area.